nervous system. So chapter 16 is going to go over the autonomic nervous system, which is also the visceral motor component of the peripheral nervous system. So I want to put it all into context as to the organization of the nervous system. So what we did on chapter 12 was we organized the nervous system into the central nervous system, or CNS, which was the brain and the spinal cord. And then everything outside of the brain or the spinal cord was the PNS, the peripheral nervous system. And the peripheral nervous system either collected information via the sensory branch, so sensory PNS, collected information from receptors. And we talked about receptors as being exteroreceptors, proprioceptors, or interoreceptors. And the sensory information that was collected via these receptors was sent to the central nervous system nerves. And these nerves were called somatic sensory. If the information that was relayed came from exteroreceptors or proprioceptor. Somatosensory. Okay. Or visceral sensory, if the information came from organs, sensory information from organs inside the body. Okay. This was also called the afferent division of the PNS. The other PNS division was the one that relayed commands to the effector organs or viscera of the body. So the effectors were not part of the center of the nervous system. The effectors belong to all other body systems in the body, and those were skeletal muscle, cardiac muscle, a smooth muscle, and glands. We said that this was the motor division of the PNS, or efferent division. And the nerves that carry the commands to a skeletal muscle, those nerves were called somatic motor. The part of the nervous system of the PNS that took care of viscera was the autonomic nervous system, or ANS, also called the visceral motor division. And the visceral motor division actually had two types of nerves. One group of nerves were called sympathetic. Another group of nerves were called parasympathetic. So that nearly every organ in the body, stomach, intestines, heart, had dual innervation. It had two sets of nerves that reached those organs. One nerve was a sympathetic nerve, the other one was a parasympathetic nerve. One nerve, one set of nerves, stimulates the organ to function, the other one stops the organ from functioning. So these nerves act as the accelerator or the brake of a car, in that one set of nerves makes the organ go and function, the other one stops it from functioning. The difference is that depending on the organ, the sympathetic nervous system will be the brake and the parasympathetic will be the accelerator. In other organs, the sympathetic nerves will be the accelerator and the parasympathetic will be the brakes. And that's where why we need to have an entire chapter just devoted to the autonomic nervous system, because this is the nervous system that controls organs in the body and the functioning of organs in the body. And one set of these nerves is going to make those organs function. The other set of nerves is going to stop the organ from functioning. So we need to look at under which conditions, which set of nerves is acting. So that's just the preamble to the chapter. So I wanted to put things in perspective and look at what it is that we're going to be actually talking about. So again, as always, stop me if you have a question. What I'm going to do is I'm going to go to the PowerPoints. And one thing about this chapter, it is a long chapter. So go by the PowerPoints only. Okay, don't, obviously you can read the whole chapter if you want to. It's a very, very important chapter and would encourage you to read the whole chapter. But for testing purposes, just go by the PowerPoints. Okay, so so the first PowerPoint introduces you to the CNN, to the ANS. This is the motor, one of the motor components of the PNS. So these are motor neurons. These are PNS, peripheral nervous system neurons. So they're going. The axons of these neurons will make up nerves around the body. The effectors that are going to be innervated will be a smooth muscle, organs with a smooth muscle, cardiac muscle, and glands, all kinds of glands, endoglands, exocrine glands, all glands. This is all involuntary and operates at the subconscious level. And one of the things the PowerPoints do is they contrast CNS and PNS, and CNS and ANS. So the somatic nervous system and the autonomic nervous system. Remember, the somatic nervous system serves skeletal muscle versus the ANS, which serves cardiac, smooth, and smooth muscles and glands. Okay. All right. So identify the two efferent motor systems or divisions of the PNS, and then compare them one to each other, compare the effectors, compare the types of fibers, compare the neurotransmitters. So that's what these first PowerPoints are going to do. So again, they want to show you this is what we're going to be talking about right here. And the SNS, the somatic nervous system, is right here. Okay. So we're going to compare based on effectors. Well, the effectors of the somatic nervous system is skeletal muscle. Let me just note here, these are actually very good PowerPoints that have a lot of information, because if you look at it, these little multipolar neuron, the body of this neuron is in the anterior gray horn of the spinal cord, because that's where the bodies of somatic motor neurons are found. The little axon leaves through the anterior roots, travels through the spinal nerve, and then exits from in between vertebra and reaches the effector organ, which is a skeletal muscle. Also note that there's only one neuron accomplishing this task. Okay. Now let's contrast that with the ANS nervous system. First of all, notice that the neuron, the body of the neuron, is located lateral gray horn, and this is material from chapter 12 actually. Lateral gray horn, because that's where the bodies of visceral motor neurons are found. Lateral gray horns. Also notice that there are two neurons in this system, not one. This will be the first neuron, exits through the anterior roots of the spinal cord, then go out through the spinal nerves and out from in between vertebra towards a ganglia. This is an autonomic ganglion, where it innervates a second neuron, and that second neuron is the one that actually reaches the effector organ, in this case a smooth muscle from the large intestines. So now what you're going to have here is a preganglionic neuron, the one before the before the ganglia, and this will be the post-ganglionic neuron. So the ANS uses two neurons versus the SNS, which uses one neuron. So ANS is a two-neuron system. Again, from chapter 12, towards the end of the chapter, we talked about types of fibers, types of axons of neurons, and we said we had type A, type B, and type C. Type A were large and myelinated, and these are going to be the somatic motor neurons, are going to be type A, large neurons that are myelinated. This chapter deals with ANS. ANS has type B as the preganglionic neuron, type C, the postganglionic neuron. So if we go back to this picture right here, The preganglionic neuron is a type fiber, meaning that it is lightly myelinated and is medium size. The postganglionic neuron is type C, which means non-myelinated and very, very small. What this is telling us basically is that the information, the action potentials, are going to travel slower in the fibers of the autonomic nervous system than in the somatic motor nervous system. Okay, because somatic has the type A large neurons. The information travels slower down the autonomic nervous system, and on top of that, there is a synapse. Every time there's a synapse, there's a delay. So it's a slower system than the somatic motor nervous system. Another difference is going to be in the transmitters. The somatic nervous system uses only one neurotransmitter, which is acetylcholine, and the effects are always stimulatory. In other words, the somatic motor neurons are going to release acetylcholine, and they're always going to stimulate the skeletal muscle. Okay. Versus the ANS. The ANS uses a couple of different types of neurotransmitters. The preganglionic fibers release acetylcholine, and the effect of acetylcholine in this case will always be excitatory. The postganglionic neuron will be excited or activated by the acetylcholine released by the preganglionic neuron. On the other hand, the postganglionic neuron can release either norepinephrine, which the acronym is NE, or acetylcholine, depending on whether we're talking about the sympathetic or the parasympathetic nervous system. The effects of norepinephrine or acetylcholine in this case on the effector organ is going to be either stimulatory or inhibitory, depending on the type of receptors that the organ has. This PowerPoint right here is very, very important. It's repeated over and over again throughout the whole chapter. And it is important because it has a lot of information. This up here is the somatic nervous system, okay, which is just here for comparison purposes. We're not going to dwell on that one. This is the autonomic nervous system right here. I want you to ignore this part for now, this middle part right here, and just concentrate on the top at the bottom. This top neuron is the sympathetic nervous system. We have two sets of neurons. Preganglionic neuron releases acetylcholine into the ganglia. Postganglionic neuron is activated by acetylcholine, creates an action potential, and releases norepinephrine into the organ. The parasympathetic neuron, preganglionic neuron, releases acetylcholine, just like the sympathetic one. The postganglionic neuron releases also acetylcholine, which in this case could be excitatory or inhibitory, depending on the receptors that the organs have for acetylcholine. Okay. So, which system is exclusively involuntary? ANS. Which system innervates blood vessels? Blood vessels are organs. They have a smooth muscle. That's ANS. Which system has only stimulatory effects on its target organ? Somatic nervous system. The autonomic nervous system can stimulate or inhibit, depending on whether it's sympathetic, parasympathetic. Which subsystem depends on a two-neuron system? The ANS. Which system uses large myelinated fibers? Oh, sorry, the SNS, type A fibers. Okay, so what we're going to do now is just going to concentrate on the two parts, ANS, sympathetic and versus parasympathetic nervous system. So notice that it says almost all visceral organs are going to have dual innervation. They're going to be innervated by both types of nerves, sympathetic and parasympathetic. It says almost, so we will point out the ones that do not have dual innervation. So the parasympathetic division is the division that relaxes the body, and it's active during rest, relaxation, during normal activities, digestion, etc. So this is the system that promotes conservation of energy, digestion. So when the body is under parasympathetic influence, the body is digesting, it's relaxed, it's conserving energy. So the activities that go along with parasympathetic division are going to be resting, digestion. So if it's depicted as a person in a hammock, relaxing, reading a book, reading, closed vision. Oops, sorry, go back to the other one. Closed vision is parasympathetic. So that's why the person is reading the book. It says crying, that's another parasympathetic event. Runny nose, that's another parasympathetic event. Okay. The heart rate will be low. Respiratory rate will be low. Okay. Blood pressure will also be lower. So blood pressure, heart rate, and respiratory rates are low. Gastrointestinal activity will be high. So digestion is taking place. Pupils are constricted because when we're looking at an object that is close to our face, our pupils constrict. Lenses are accommodated for close vision, so the person is reading. Contrast that with the sympathetic nervous system, which is also called the flight or fight response. So this is the system that activates the body for response to stress. This is what happens during exercise, for example, or when we feel threatened. Our blood pressure is going to increase. Heart rate is going to increase. Respiratory rate is going to increase. The respiratory airways are going to be dilated. And this is here is important. Blood flow is going to leave from organs that are not needed in times of stress. That will be digestion, that will be the urinary system, reproductive system. Blood will leave these organs and will be diverted to the organs that need the extra blood flow. That will be the skeletal muscles, that will be the heart, that will be the brain, the respiratory organs. Liver is going to release glucose, so we're going to have an increase in blood glucose also. Okay, so that's the sympathetic response. So based on the function, on the type of response that these nerves produce in the body, we can say that the parasympathetic response is rest and relaxation. Sympathetic is called flight or fight. Okay. So sympathetic nervous system, name based on its function, flight or fight. Parasympathetic based on its function, rest and relaxation. Now, again, there are a group of nerves that are sympathetic, another group of nerves that are parasympathetic, meaning the message being sent through those nerves are going to cause the body to relax and digest, or in the case of sympathetic, respond to stress. Turns out parasympathetic nerves are either cranial nerves, right here, more cranial nerves over here, or sacral nerves. So there's a small group of cranial nerves which are parasympathetic. They relay parasympathetic information, and you should definitely know those nerves. They're in chapter 13, and we'll go ahead and review them today. And then the other set of nerves are coming from the sacral spinal nerve division. Sympathetic division, the nerves are coming from the thoracic and the lumbar division of the nervous system, of the PNS. Okay, so sympathetic nerves leave from the thoracic area of the spinal cord and the lumbar area of the spinal cord. So structurally speaking, the parasympathetic division is called the craniosacral division, and the sympathetic is called the thoracolumbar division, by describing what set of nerves are found in each of these two divisions of the PNS. So the thoracolumbar division will be sympathetic. The craniosacral division will be parasympathetic. The cranial nerves that are parasympathetic are going to be cranial nerve number 3, cranial nerve number 7, number 9, and number 10. So the oculomotor, facial, glossopharyngeal, and vagus. Okay, so sympathetic, anatomical name, thoracolumbar division, physiological name, flight or fight. I will go into this in just a second. Parasympathetic, anatomical name, sacral, physiological name, rest and relaxation. Yeah, the ganglia, the sympathetic ganglia is located close to the spinal cord. The parasympathetic ganglia is located close to the effector organ. And I'll show you a picture here of that. Okay, so in the parasympathetic division, the ganglia is located close to the organ, and for that reason, the preganglionic fiber is long, postganglionic fiber is short. In the case of sympathetic, the ganglia is located closer to the spinal cord, so preganglionic fiber is short, postganglionic fiber is long. Okay, and actually you can see that from this picture. In this, again, I told you this picture is very, very important. It has a lot of information. You can see in the sympathetic division, preganglionic fiber is shorter because the ganglia is close to the spinal cord. Postganglionic fiber is longer because it needs to reach the organ. Parasympathetic, preganglionic fiber is long because the ganglia is located close to the organ, far away from the spinal cord. Postganglionic fiber is short. And now take a look at something else too that this picture is showing you. Notice that the preganglionic fiber is myelinated, lightly myelinated. Postganglionic fiber is non-myelinated. So that was a type B versus type C fibers. Same thing for the parasympathetic. Preganglionic fiber myelinated, postganglionic fiber non-myelinated. Okay. All right. Questions? Okay, so what we're going to do is we're going to concentrate on the ganglia of the parasympathetic nervous system because they are ganglia of the cranial nerves. So remember we said there are 4 cranial nerves that are parasympathetic, that are carrying parasympathetic information. And those were cranial nerve number 3, motor, number 7, facial, number 9, glossopharyngeal, and 10, which is vagus nerve. So the ganglia of cranial nerve number 3 is called the ciliary ganglia, and the postganglionic neuron is going to leave the ciliary ganglia and reach the eye, is going to innervate the pupil and the lens of the eye. So the ciliary ganglia, the postganglionic neuron is actually going to pierce the eyeball, go inside the eyeball, and innervate the pupil and the lens. Cranial nerve number 7, which is facial, has 2 ganglia, the pterygopalatine ganglia and submandibular ganglia. Pterygopalatine goes to the lacrimal glands. Submandibular is going to go to salivary glands. Nerve number 9, glossopharyngeal, has the otic ganglia, which also goes to salivary glands. And finally, cranial nerve number 10, which is the longest cranial nerve, the vagus nerve. The ganglia is just several of them, called intramural ganglia, and they're going to go to the organs in the thoracic and abdominal cavities. Notice that the other cranial nerves are staying in the head, in the eyes, salivary glands within the head, versus the vagus nerve, which is going to the organs of the abdominal and thoracic cavities. Cranial nerves numbers 2, 3, and 4 are parasympathetic. These are not cranial nerves, sorry, sacral nerves. And the ganglia is again called intramural ganglia. So intramural ganglia is just a generic name for all of the ganglia that's close to organs. And in this case, the sacral nerves are going to serve organs in the pelvic viscera. That would be the urinary bladder, reproductive organs. So this is another chart showing you the ganglia and what these ganglia serve. And then if you look at this picture here, you can see the ciliary ganglia going into the eye, the pterygopalatine ganglia going to salivary glands, the nose, sorry, this one is going to lacrimal glands and salivary and the nose. The submandibular ganglia is going to salivary glands, and the otic ganglia is going to salivary glands also. And then you have the vagus nerve innervating organs of the thoracic and abdominal cavity, sacral nerves innervating organs of the pelvic cavity. And yet another picture of the same, in this case is showing you cranial nerve number 3, oculomotor, going to the ciliary ganglia and from there into the eye. Cranial nerve number 7, which is the facial nerve, going to the pterygopalatine ganglia and from there to the lacrimal and salivary organ glands. And otic right here for number 9, that's salivary, actually, there we go. Otic right here for number 9, going to salivary glands. Okay, any questions? All right, moving right along. For the sympathetic division, we're not going to be as precise when it comes to the ganglia. We're just going to give them generic names. There's 2 sets of them. One of them are close to the spinal cord, and we call them paravertebral. They are on either side of the spinal cord. The ones in front of the spinal cord are called collateral ganglia. So they're here depicted as, this will be the paravertebral ganglia right here. This will be the collateral ganglia. And we're not going to worry about their names, individual names. So you're just going to give them the name, a generic name. So essentially, this is just showing you the wiring and how sympathetic nerves will leave from the lateral horn of the spinal cord, go out, and innervate at the collateral ganglia, or they could innervate at the paravertebral ganglia right there. Okay, so there's 2 sets of ganglia that are sympathetic. One set is following the spinal cord on either side, that's the paravertebral. The collateral will be in front of the spinal cord. Okay. Let's see. Yeah, but we're not going to worry about all this wiring right here. It's just essentially going over the same information. Oh yeah, this PowerPoint here is showing you the paravertebral ganglia right there, next to the spinal cord. All right. The preganglionic fibers of the sympathetic nervous system form what we call the splanchnic nerves. And again, we're not going to worry about individual names of the collateral ganglia. We're just going to call them collateral ganglia. Okay. Let's see. Okay, now this is important. There is a set of fibers, of sympathetic fibers, preganglionic fibers, which are going to bypass the ganglia, paravertebral and collateral ganglia, and instead are going to go directly to the adrenal medulla. The adrenal medulla is a series of glands located on top of the kidneys, and these are endocrine glands that secrete hormones. So these fibers, these sympathetic fibers, are going to reach the adrenal medulla, and within the adrenal medulla, they're going to stimulate another set of neurons into secreting hormones. The hormones are norepinephrine and epinephrine. And by definition, hormones are secreted into the blood. Now, note that norepinephrine is both a neurotransmitter and a hormone. So when a sympathetic neuron releases norepinephrine into an organ, like the heart, for example, that is a neurotransmitter. Yeah, I'll show you in just a second. The adrenal medulla is found the adrenal glands are found on top of the kidneys, and the adrenal medulla is the inner part of the adrenal glands. And I'm going to show you a picture here in just a second. But yeah, that's a good question. So this is a neurotransmitter. In the case of the adrenal medulla, let me show you here. Go back to, let me see if I have it down. Yeah, down here. Take a look at here. Okay, so these are the adrenal medulla. I mean, this is the adrenal gland right there. So if you look at the kidneys, a picture of the kidneys, they're going to have a little gland on top of them. That little gland is the adrenal gland. And this is actually two glands, not one. The outside is the adrenal cortex, which we're not going to talk about until next semester. The inside is the adrenal medulla. So the sympathetic fibers, preganglionic fibers, reach the adrenal medulla and stimulate little neurons in the adrenal medulla to secrete hormones into the blood. The hormones secreted are going to be epinephrine and norepinephrine. Notice that epinephrine is also a neurotransmitter secreted by sympathetic postganglionic neurons into organs. So norepinephrine is both a neurotransmitter and a hormone. Epinephrine is only a hormone. Okay. So let me go back. Yes, do you have a question? Confused at the bottom of the key. I'm sorry. I don't think I understand. Okay, so you're confused. Oh, okay, got it. All right, so and we're actually going to talk about these next semester, but that's okay. The adrenal glands, yeah, that's the adrenal gland right there. And it's actually two glands. You can say the outside is one gland, the inside is another gland. And the medulla is the inside part. So they're not going into that much detail here. All they're doing is they're showing you the little adrenal gland and the sympathetic fiber going into the adrenal gland. That's all they're doing. Yeah, no problem. Oh, I see the circles and the triangles. Okay, you're talking about these right here. Yeah, this is norepinephrine. This is acetylcholine right there. And let me clean it out. So yeah, over here, now I see what you're saying. Okay, so this is what's happening. That's actually a good question. All right, this is the preganglionic fiber, the sympathetic fiber going into the adrenal medulla. This is a presynaptic neuron. Remember, the presynaptic neuron release acetylcholine. Acetylcholine are the little triangles. So the acetylcholine is being released, which are the little triangles you see here. And then there's another set of little neurons in the adrenal medulla which respond to the acetylcholine by releasing norepinephrine. The difference is that in this case, the norepinephrine is being released into a blood vessel. And in that, the minute it's released into a blood vessel, now it becomes a hormone. Now it's not a neurotransmitter anymore, because neurotransmitters go from neuron to organ. In this case, if it goes into the blood, it's called a hormone. So that's what these little circles are, is the an epinephrine and norepinephrine. Okay. So, okay, good. All right, so what we're going to look at now is the neurotransmitters and their receptors. Okay, so let's see. Again, both sympathetic and parasympathetic presynaptic neurons release a neurotransmitter, the same kind of neurotransmitter, which is acetylcholine. The postsynaptic neuron is going to have the receptors for acetylcholine. Let's make these the receptors. The receptors have names. We're giving them names. So acetylcholine binds there. Okay. All right. The receptors have names. These receptors. Okay. Just want to see. Okay, they're not here, but that comes next. Are called nicotinic receptors. And the receptors are going to be sodium channels, which are always going to cause an action potential to be created, or a graded potential, which will turn into an action potential. So it's going to depolarize the cell and make the postsynaptic neuron secrete its own neurotransmitter also, which will be either acetylcholine in the case of parasympathetic fibers or norepinephrine in the case of sympathetic fibers. Okay. So notice that postganglionic neurons are going to have a neurotransmitter for acetylcholine, regardless of whether they are sympathetic or parasympathetic, because the preganglionic neuron releases, in both cases, releases acetylcholine. Okay, so that neurotransmitter, gosh, I was getting ahead of myself. Give me a sec. Yeah, that neurotransmitter is called a nicotinic. That receptor is called a nicotinic receptor. The nicotinic receptor is a sodium channel and always depolarizes the cell, so it is always stimulatory. So we're going to have nicotinic receptors in this cell, so that when this cell receives the neurotransmitter acetylcholine, it will be activated and in turn creates an action potential that secretes norepinephrine. We're going to have nicotinic receptors in this cell, so that it will always be stimulated by acetylcholine into creating an action potential, and at the end secretes acetylcholine towards the effector organs. Okay. The receptors for acetylcholine are called cholinergic receptors, and we have two types: the nicotinic receptors, which we have talked about. The other type of cholinergic receptors that receive acetylcholine are called muscarinic receptors. Muscarinic receptors are found in organs. So let me go back here. So in this case, the organs, the heart, the intestines, the stomach, are going to have muscarinic receptors. And muscarinic receptors can be excitatory. It can depolarize the organ, the muscle of the organ, or it may inhibit the muscle or the organ. So muscarinic receptors can be excitatory or inhibitory. Okay, so let me go back here. Again, nicotinic receptors found in postganglionic neurons of both sympathetic and parasympathetic nervous system. The receptor is always stimulatory. Okay. Nicotinic receptors are also found in the adrenal medulla, as we saw in the picture. The adrenal medulla here, the preganglionic neuron is secreting acetylcholine, means the little cells here need to have nicotinic receptors. So nicotinic receptors always create a depolarization because they are sodium channels. So nicotinic receptors found in skeletal muscle, okay. Nicotinic receptors found in the body and dendrites of postganglionic neurons from both parasympathetic and sympathetic and adrenal glands. Muscarinic receptors, on the other hand, can be inhibitory or excitatory, and they are found in the effector organs that are served by the postganglionic fibers. So depending on the receptor type of the target organ, an inhibition of the organ will take place or an excitation of the organ will take place. Let's give you a more specific example. Let me give you a specific example. So this is all parasympathetic. Okay, so we have parasympathetic neuron, preganglionic neuron, secretes acetylcholine. The postganglionic neuron has the nicotinic receptor, accepts the acetylcholine, which activates the neuron, and it secretes again acetylcholine. But now this acetylcholine secreted by the postganglionic neuron is going to go and affect an organ. Let's say that the organ that it affects is the heart. The heart has nicotinic receptors that are going to receive the acetylcholine. And these nicotinic receptors are potassium channels, so that when the acetylcholine binds to the receptor, potassium channels open, potassium leaves the heart muscle is hyperpolarized, shut down. It cannot contract, it slows down, so that the parasympathetic nervous system is going to make the heart beat slower, because it's going to take it longer to create a beat, because it's going to be hyperpolarized, because the nicotinic receptor of the heart is a potassium channel. Let's have the same story now, but instead of the parasympathetic neuron hitting the heart, now it's going to go to the intestines. This is the preganglionic neuron, secretes acetylcholine, nothing new there. Postganglionic neuron has the nicotinic receptors that accept the acetylcholine, okay, and activates the neuron into secreting acetylcholine. But now it's going to secrete acetylcholine into the stomach. The nicotinic receptor, the muscarinic receptor in the stomach is a sodium channel, so that when acetylcholine binds to it, now sodium channels open and the cell is depolarized and it activates the muscle and we begin to digest. So the nicotinic receptors could be inhibitory, as in the case of the heart, or they could be, same nicotinic receptors are now going to be, yes, the heart has nicotinic receptors. No, sorry, I'm so sorry. Thank you for, oh my gosh, thank you for correcting me. Muscarinic receptors. The muscarinic receptors of the heart, muscarinic receptors, are potassium channels which inhibit the heart. The muscarinic receptors in the stomach are sodium channels which activate the stomach. Okay, so hopefully that makes sense, and that's why muscarinic receptors can be inhibitory or excitatory. Good, no problem. All right, so that takes care of parasympathetic. Let's deal with sympathetic. The receptors for norepinephrine can be alpha or beta receptors, and they can be, again, excitatory or inhibitory. So we have two types of receptors, alpha and beta. All right, and essentially the same story. Some organs are going to have alpha receptors. Some of the alpha receptors will be sodium channels, which means they're going to be stimulatory. Some alpha receptors will be potassium channels, which will be inhibitory. Same thing for beta receptors. Some are sodium channels, which means they're going to be stimulatory. Some are going to be potassium channels, which means they're going to be inhibitories. Okay, so it varies depending on the organ. So for example, over-the-counter drugs for colds, allergies, and nasal congestions stimulate adrenergic receptors, alpha receptors. So this will be alpha receptors. Okay, these are going to be decongestants. Congestion is a parasympathetic activity. If you stimulate sympathetic activity, that's going to dry up the mucosa of the respiratory tract. So parasympathetic activity stimulates nasal congestion, it stimulates secretions in the respiratory mucosa. sympathetic receptors stop those secretions. So if the drug stimulates alpha receptors, it's going to stimulate the drying up of the nasal mucosa. That's one application of this knowledge. Beta blockers are drugs that block beta receptors, okay? And they prevent sympathetic stimulation of the heart, for example. That's going to lower blood pressure. So beta blockers are blood pressure medications that lower blood pressure by blocking the beta receptors in the heart, which receive sympathetic stimulation. Again, another group of drugs attached to beta-2 receptors in the lungs, and that's going to dilate the lungs of asthmatic patients. Constriction of bronchioles, the constriction of the respiratory tubes, is a parasympathetic response. So an asthma attack is an exaggerated parasympathetic response. In order to block that, we need to use sympathetic drugs because the sympathetic response is to dilate the respiratory ducts. And that makes sense because if you're going to be under stress and running, you want your respiratory pipes to be opened up in order to get as much air as possible. When you're relaxed and calm, they can close a little bit because you don't need as much oxygen. So sympathetic drugs are used during asthmatic attacks to open up the respiratory pipes. So this is practical application of all of this knowledge. So most visceral organs have dual innervation. We've talked about that. You should know the sympathetic response and the parasympathetic response on the major organs. So sympathetic responses in the heart, we're going to increase heart rate. We're going to increase respiratory rate. Okay. We're going to dilate respiratory pathways. On the other hand, what's going to be inhibited will be digestion, the urinary system, elimination. By the same token, parasympathetic division decreases heart rate, decreases respiratory rates, and increases respiration and the elimination of waste. Okay. Sympathetic divisions control blood pressure even at rest. Yes. So, okay, let's see. This is something important to remember, especially for next semester. Blood vessels have only sympathetic innervation. So remember we said most organs have dual innervation, except for a few organs. This is one of the exceptions. Let me go back. And this is important. And I'm going to rephrase that. Most blood vessels. There's a few exceptions. Most blood vessels have only sympathetic innervation. Okay. So the sympathetic nervous system is going to control most blood vessels. And by doing that, it controls blood pressure. Okay. That's what we call the vasomotor tone. What the sympathetic innervation is going to do is continually partially constrict blood vessels to keep up with blood pressure. So when sympathetic fibers stimulate, blood vessels are going to constrict more, and that's going to increase blood pressure. If the sympathetic fiber fires less rapidly, that's going to constrict the blood vessel less. That's going to promote dilation of blood vessels, and that's going to decrease blood pressure. Alpha blockers are the drugs that interfere with the receptors for the sympathetic neurotransmitter norepinephrine in blood vessels, and that's going to be used to decrease sympathetic activity in blood vessels, which is going to decrease blood pressure. That's another blood pressure medication, but this one acts on the blood vessel, not on the heart. So beta blockers act on the heart, alpha blockers act on blood vessels. By dilating them, decreasing sympathetic innervation decreases the constriction of the blood vessel, dilates the blood vessel, and that decreases blood pressure. Okay. So sympathetic innervation of blood vessels is what we call the vasomotor tone. Parasympathetic division dominates the heart and is constantly lowering the heart rate. And we call that the parasympathetic tone, and is also dominating digestion and excretion at the urinary tract. So parasympathetic tones, parasympathetic activity slows down the heart and stimulates digestion and elimination. Okay. All right. So we said that the parasympathetic tone is what is slowing the heart at all times, except at times of stress. During stress, sympathetic is going to override the parasympathetic tone of the heart and is going to increase the heart rate. So any drug that blocks parasympathetic response is going to increase heart rate, block fecal and urinary retention. Okay. So we said that blood vessels are innervated exclusively by the sympathetic nervous system. For the most part, there's just a small exception that we're going to see next semester. But for the most part, you can think of all blood vessels for now having only sympathetic innervation. Other organs that have exclusive sympathetic innervation will be the adrenal medulla, sweat glands, the rectal pili muscle of the hair in the skin, kidneys, and most blood vessels. Okay, we talked about most blood vessels already. Okay. Okay. So the sympathetic nervous system, by controlling the sweat glands, is going to control thermoregulation response to heat. By innervating the kidneys, is going to control the release of a hormone by the kidneys called renin, which actually lowers blood pressure. And this will make sense actually when we look at the kidneys next semester. Okay. Metabolic effects of the sympathetic nervous system: increases metabolism in cells, raises blood sugar levels, and mobilizes fat for use as fuel. Again, we get ready to run, flight, or fight. Parasympathetic division is short-lived and highlights control over the effectors. Sympathetic division, on the other hand, is long-lasting, and the reason why is because sympathetic division is going to innervate the adrenal medulla, and the adrenal medulla is going to secrete epinephrine and norepinephrine hormones. And these are sympathetic hormones that are going to have exactly the same effect as the sympathetic nervous system. They're going to increase heart rate, they're going to increase blood pressure, they're going to increase respiratory rate, they're going to inhibit digestion. Exactly the same effects. The difference is a hormone stays in the body for a long time because it has to be eliminated via the kidneys. So it's going to take a long time to be eliminated, whereas a nervous response is very quick. Because parasympathetic nervous system does not have hormones, its effects are short-lived. Okay. All right, so again, sympathetic activation is long-lasting because of norepinephrine. Norepinephrine and epinephrine are hormones released into the blood and remain in there until destroyed by, destroyed by the liver, but are going to have to be released by the kidney, urinated out. All right. Okay, last thing here that we're going to talk about is control. And the sympathetic and parasympathetic nervous system are controlled by the brain, more specifically by the hypothalamus. That's where the control occurs. So this is the main integrative center for the autonomic nervous system. So whatever influences the hypothalamus will influence the ANS activity. So for example, the limbic system, which is emotional system, influences the hypothalamus, and we're going to get an autonomic nervous system response to emotions, for example. So our heart rate could go up, for example, or blood pressure could go up, for example, due to emotional responses. The cerebral cortex and the reticular formation, and to some extent the spinal cord, do also have some control over the ANS, especially when it comes to reflexes like digestion, for example. The spinal cord will be or elimination. The spinal cord will be involved in that. Okay, so this is the hypothalamus, the one that controls the ANS. The cerebral cortex is in contact with the limbic system, and so there is a back and forth input, and the limbic system is a back and forth input with the hypothalamus. The hypothalamus in turn can control the brainstem, which can regulate things like heart rate, blood pressure, respiration, etc. The spinal cord is in charge of elimination, like defecation, urination, sexual responses. Okay. So one of the things you definitely need to know for this chapter is the influence of sympathetic and parasympathetic nervous system on the organs. This is something that is going to follow us to next semester, and that's why it's emphasized so much in the chapter. There is a chart under study guides that summarizes all of this information, so I encourage you to go over this chart. But as a recap, let's go over again the effects of the sympathetic nervous system and the parasympathetic nervous system. So sympathetic nervous system is going to increase heart rate, is going to increase blood pressure, is going to increase blood glucose, what else? Is going to respiratory rate. Is going to increase respiratory rate. It's going to dilate pupils. Is going to stimulate sweat. It's going to stimulate sweat glands. Is going to stimulate release of epinephrine and norepinephrine hormones. It's going to decrease digestion. It's going to decrease elimination, and that includes urine output. Okay. When it comes to heart rate, it not only increases the heart rate, but increases contractility. So it not only makes the heart beat faster, but the contraction will be stronger. So contractility. Oh, one last thing. It's going to constrict blood vessels. And that's why blood pressure is going to increase. It actually constricts peripheral blood vessels, but okay, we're going to leave it at that. We're going to go back to these next semester over and over again. It's also going to dilate respiratory airways. So bronchioles will be dilated. Okay, that's sympathetic. Let's go over parasympathetic. So parasympathetic is going to decrease heart rate, decrease respiratory rate. What else? Decrease blood pressure. increase digestion, increase elimination, increase salivation, constrict pupils, what else? Constricts airways. So bronchioles will be constricted. Increases mucus secretions in the respiratory tract. Okay, I cannot think of anything else. That's the main thing. Notice that parasympathetic nervous system is served by 4 cranial nerves. You should definitely know the cranial nerves. Notice that the sympathetic is not served by cranial nerves. So there are no cranial nerves in the sympathetic nervous system. Also, parasympathetic nervous system, there is no innervation on most blood vessels, nor no innervation in the adrenal glands. Okay, that's it for this chapter. Any questions? Yeah, elimination refers to defecation and urination. So making urine and feces. So yeah, so because the parasympathetic nervous system stimulates digestion, it will also stimulate defecation. The parasympathetic nervous system will also eliminate voiding from the bladder, so urination. Any other questions? Very good. Okay, perfect. So hopefully this makes this an easier chapter. It is an incredibly important chapter, and I cannot emphasize enough, it's going to follow it next semester. From day one, we're going to go back to all of this information, and we're going to come back to it over and over again. So it's probably one of the most important chapters of the whole semester.